estrogen is pretty protective. And so when you're going through your early teen years, 20s, 30s, that estrogen presence is actually preventing the progression of atherosclerotic disease, which is really the precursor to heart attacks, strokes, things like that. But as estrogen levels decline, that's when we start seeing more plaque development. That's when we start seeing our risk factors go up. That's when we start seeing more things like hypertension, high cholesterol, prediabetes or diabetes, which are all contributing factors to things like stroke, heart attack.
I'm not afraid to write a brand new story. And what changes find a way to me, I can keep it moving. I'm not afraid to celebrate my glory. And when challenges grace my path, I know I can face another day. Inside, I rise, daring to learn. With Fox After 40.
What's up, you guys? Welcome back to Fox After 40. I'm your host, Kim Lewis, CEO and co-founder of CurlMix, and this podcast is all about women's wellness. Today, we have an OBGYN here with us, Dr. Taniqua Miller, here to discuss cardiometabolic health, and I cannot wait to get into it. Welcome to the show, Dr. Miller.
Thank you for having me.
Can you give us a bit of your background, where you're from, what you do, and your specialty?
Sure. So I am an OBGYN by training. I went to Harvard for medical school and Yale undergrad, major in psychology, love understanding people. So of course that was very fitting to go into OBGYN and dedicating my life to women's health. Over the last decade, I have really honed in on perimenopausal and menopausal health, caring for women in midlife.
Beautiful, beautiful. Can you please explain to us what cardiometabolic health is?
Yes.
I can kind of guess cardio, heart, but can you be more specific and explain exactly what we should be considering?
Absolutely. And this is specifically important as we're getting older, as we're transitioning through the menopausal transition, because our cardiometabolic parameters will change and actually increase our risk for cardiovascular disease. So when I'm thinking about cardiometabolic health, I'm thinking about all of those risk factors that actually can contribute to things like atherosclerotic disease progression. What is that?
Can you say that again? Yes.
Yeah. Atherosclerotic disease progression. When we think of things that are facing us, especially in our community, when it comes to risk of heart attack, risk of stroke, that's what we're talking about. When we look in the United States, I always say that we're really good at our cancer screenings like mammograms and colonoscopies and the like, but that's not what kills us. What kills us is heart disease. And so as we're transitioning through the menopausal transition in midlife, we have to recognize that one of the biggest things that we should focus on is our cardiometabolic health. And what we're referring to there is our risk for hypertension, our risk for hyperlipidemia or elevated cholesterol and the like, as well as our risk for diabetes.
And this is just me with a personal question. Can you give me some background around heart health as a child moving into adulthood, and then like what to expect after 40?
Yeah, absolutely.
I have no idea about heart health as a child. I just know your heart beats faster, and then I know it slows down, and then I know you should be, checking it with your neck every for 10 seconds, and then multiply times 5 or 10. I don't know. So can you just kind of tell me what's the progression? What's the progression?
So when we think about cardiovascular health, generally in your child years, teen years, in your young adult years, we generally consider that like healthy. We start seeing really risk factors develop as we're getting into our 30s and 40s. Most times we have general sense of exercise, eating balanced diets, maybe more time. But as we're getting older, especially as we're navigating the menopausal transition and starting to see estrogen levels decline, we start really having an uptick in terms of risk factors for cardiometabolic disease. And so the way that I think about it is that estrogen is pretty protective. And so when you're going through your early teen years, 20s, 30s, that estrogen presence is actually preventing the progression of atherosclerotic disease, which is really the precursor to heart attacks, strokes, things like that. But as estrogen levels decline, that's when we start seeing more plaque development. That's when we start seeing our risk factors go up. That's when we start seeing more things like hypertension, high cholesterol, prediabetes or diabetes, which are all contributing factors to things like stroke, heart attack.
Okay, can we back up a little bit, Dr. Taniqua? You're very smart. You're very smart. And I need you to break it down for me for my 7-year-old. So your heart pumps blood through your body.
Yes.
It is a muscle.
It is
right?
a muscle.
Okay. And I don't know, like, do you know like normal beats per minute for like a child versus an adult? Or
So I'm not a pediatrician.
Okay, I gotcha.
But from an adult, we like to see the heart rate anywhere between 60 and no more than 100. That's considered like normal range.
Okay.
And of course, that will fluctuate throughout the day. Our body is constantly under surveillance for our activity, for the environment, and so it will regulate that heart rate to give us, the blood pressure that we need or what have you.
And so an easy way to check it would be like, so if it's 60 to 100, and so I guess you time 10 seconds, and
you could do that,
and then you count.
Yep.
And
or sometimes I say 6. Count to 6, and then I times by 10 because I'm not great with math.
Okay. Oh, okay. Gotcha. And then what are the ranges of your heart rate and what it means?
So generally at rest, we like to see lower heart rates at rest.
Okay.
That generally is a sign of good aerobic tolerance, where if you're at rest and your heart rate, you've sat down for 5 minutes, you're at rest, you're not doing any vigorous exercise or anything like that, then you will see your heart rate usually at the lower end of things.
Okay.
And so I like to see heart rates, in the 60s and the 70s for that.
Those professional athletes, what are their heart rates?
So especially like my professional athletes, my runners, et cetera, they tend to have really low heart rates because of their aerobic endurance. And so sometimes at rest, their heart rates can get as low as like the 50s.
Okay, gotcha. And so you're saying the heart rate shifts. At what point does it go from 70 to 80 to 90 to 100, like, you know what I mean?
Yep. It's all dependent on what's happening. So
Okay.
at rest, things are calm, you're in that kind of good homeostasis. Your heart rate's probably going to be on the lower end of things.
When should you be worried? Like,
when should you be
when
worried?
you're resting and it's above this, like, that's not good.
I don't know if there's a hard and fast number, but if I have a patient that like is at a resting heart rate that's like really elevated, greater than 90 or even at 100, or if I have a patient that when they're resting, they're aware of their heart rate, so they're starting to have like palpitations or they can feel like their heartbeat is skipping, that's when I generally recommend that they see a cardiologist, have their workup, which can include something like an EKG or electrocardiogram. Sometimes there are tests that you can do where you can keep an EKG on for a period of time to watch you over time to see what's going on with the heart. People will keep diaries. I feel it at this time of the day. And the reason for that is, well, especially for what I do with perimenopause, a lot of women may say, I'm having palpitations, but we can never rule out the organic issues with the heart. And so that's where I bring in my cardiology colleagues.
Okay, so we're looking at 60 to 80 beats per minute kind of resting.
When that
is 80 high or no, it's normal?
Normal.
Okay, gotcha. All right. And then I know that Black women are predisposed, or we tend to have more issues, or Black people in general. Can you speak to that? Why do you think that might be? And what do you see in the research?
So a couple of things, especially as it relates to midlife and beyond. So a couple of things with that. The experience of the menopausal transition and the declines in estrogen. And there's some data that links it to the severity of your menopausal symptoms, including the frequency, the length of your perimenopause, how severe your symptoms are, whether they're, on a scale of 1 to 10, you're having 10 out of 10 in terms of your hot flashes, night sweats, things like that. There is a direct linkage between that and later cardiovascular disease. I think we can't ignore that we are in the United States and the role of racial discrimination. So there was actually a study, it's called Study of Women Around the Nation, called SWAN Study, and it actually was one of the first studies that looked at the impact of the menopausal transition through racial and ethnic breakdowns. And it found that for Black women specifically, not only did they have a longer period of perimenopause, but their symptoms were more intense and more severe. Now, what that translated to was, why was that? So a couple of things. The impact of racial discrimination as like an independent risk factor for some more of the severity. We also see that there's a concept called weathering. Are you familiar with that concept? The concept of weathering, that when you're in a system where you're facing barriers to access, a lot of what we call social determinants of health, where maybe you don't have access, maybe you're not in a place where you can have a relationship with a medical team, or you're facing discrimination on a day-to-day basis, it creates this increased stress to the system.
Yeah, for sure.
And that increased stress to the system over time causes high blood pressure elevation, causes almost like an overactive fight or flight drive, right? Where your sympathetic nervous system is in overdrive. You're getting all of that signaling from inflammation, cortisol release, your body trying to protect you from the stress of the racial discrimination and all of those other things, but with deleterious effects.
It's costly to be a Black woman.
Costly.
Oh my gosh. You said something that I want to go back on. You mentioned that the more frequent or intense your hot flashes, the more connected they were to heart disease.
Yes.
That's wow. I mean, that sucks.
Yeah,
Like,
definitely.
how do you know if your hot flashes are intense versus normal? If you've gotten any value from listening to Fox After 40, you learned a beauty tip, you've gotten advice, you shared the episode with a friend, please do us a favor and leave us a review on Spotify and Apple. It goes a very long way in helping us continue to build the podcast. Thank you so much, and I'll see you in the next episode.
Oh, that's a great question, because unfortunately for many women, we have been taught from very young age that women's issues, no matter how severe they are normal. So give an example of, like, you may have someone who is starting to experience menstrual cycles, their bleeding is really heavy, they're having pain that they're requiring to miss school or even be picked up from school. They may go to a doctor and they're like, oh, this is normal. And it's not normal. And so for a lot of people during the menopausal transition, especially since there's not a lot of discussion around it, now there's more, but like there wasn't a lot of discussion around it. We have people who are missing sleep. So maybe they're waking up multiple times a night and maybe only getting 4 to 5 hours of quality sleep. We're having people who are breaking out in multiple hot flashes, sometimes 9 hot flashes during the day. And what's happening physiologically is that they're actually getting heart rate elevations with this. They're getting body core temperature elevations with this, again, putting them in that stress response. And they might think it's normal. They might think that this is what happened.
Heart rate? What's the range of a heart rate for a hot flash?
Yeah, so usually we might see a heart rate elevation from anywhere from 5 to almost 15 beats per minute. So think of it, like if you're out and you're doing your activities and then all of a sudden you have a hot flash, if your heart rate was at 85, it might go up to 100 and you will feel that. You will feel that. And for some people, that's very scary, right? When they're feeling their heart racing, they're also experiencing, for many women, is very uncomfortable hot flash. We know that it's physiologic. We know physiologically why it's happening, but there's also a lot of external things. Like imagine, I see a lot of executives, right? I used to, in my academic practice, used to see a lot of executives. And I had one woman tell me, I'm in the middle of a board meeting. I'm at the top of my game and I break out in a hot flash. I just blew my hair out. I got sweat dripping down my face and I literally have to excuse myself. So not only are you dealing with the physiologic, your heart racing, the sweating, but then also some of the implications of that, especially when you're at, living in your midlife.
Ooh, it's almost like a panic attack.
Yes. For many people, they feel like it's a panic attack.
That's not, how are people managing? How can you manage that? What are you recommending?
So when we think of the approach to hot flashes, it's important to understand the physiology behind a hot flash. So why is it happening? So there's a center in our brain, a thermoregulatory center in the hypothalamus that is constantly regulating our core body temperature. And so if we're really, really hot and our body needs to cool, we start to sweat. If we're really, really cold, our body starts to shiver to kind of generate that heat. When you're moving through the menopausal transition, maybe your range was really wide, but as estrogen levels start to decline and fluctuate during that transition, that will narrow. So now it only takes just a little bit of body core temperature elevation to trigger this very profound hot flash response, and the same too for low body temperature. So some people will say I actually get cold flashes where I'm like shivering, that sort of thing. And so when we understand that, and we understand that the role that estrogen plays in that tends to be where we start. Estrogen therapy is still considered the gold standard for treatment of these vasomotor symptoms. And we know in terms of a concept called the timing hypothesis that when you introduce therapy closer to the menopause, which is when you stop having a period for a year, that you're going to get the most benefit. Now, what I mean by that is, I told you there's a link between your hot flashes, night sweats, those big intense vasomotor symptoms, and heart disease. What the studies have shown us is that when we can target treatment to the earlier part, right? Not when you're in your 60s, but when you're in your 40s, when you're starting to experience those symptoms, if we can control those symptoms then, you're going to have better cardiovascular outcomes. Gotcha. So you're going to have a better heart risk profile. So if you learn
to manage your hot flashes now, it'll be better for reducing your risk of heart disease later.
Absolutely.
Okay.
And that is well established.
And then something that triggers the hot flashes is typically basically an elevation or reduction in your temperature. Basically, like if your internal body temp gets cold.
Or if it's hot. Right?
So if it's hot, it makes it hotter?
So if it's hot, the hot flash, your body is trying to cool itself off. How does your body cool itself?
Gotcha,
exactly.
Gotcha. So you need to make sure you stay in a cold area all the time.
Well, so that's the other part of management. How can we change the environment such that we are helping to manage. So I have some patients that in addition to hormone therapy or other non-hormonal treatments that also target that physiology, then they will say, okay, well, I'm going to dress in layers, right? So that if I feel that the temperature is changing in the room, I can accommodate. I'm going to pay attention to my triggers. There are some foods, some like alcohol, spicy foods, even chocolate.
Oh yeah, I heard chocolate is a big one.
That can actually trigger some of these hot flashes. And I'm like, chocolate because I love chocolate, but it does make me hot. As a proud patch wearer myself. But like you literally start looking into your environment and knowing. And what I realized that a lot of my patients, they will say, you know what? I'm going out tonight. I know that this is a trigger for me. I know, just having the education saying, I know that this may happen, but I'm ready for it. And so the education piece is so important because I think for many people, hot flashes could take you off guard. They make you feel like you said, like you're in a panic, right? Like all of a sudden you relaxing and then all of a sudden this hot flash happens and you're sweating and your heart starts racing and you just feel not in control of your body. So having the education to understand why it's happening and how to really course correct in the middle of a hot flash is important.
So it really sounds like you need to quit that job that is stressful because it's really gonna
quit the job, honey.
No, because it sounds like it's gonna give you hot flashes. I mean, I'm not.
Yeah.
So I know we talked about we're talking about menopause and women going through the hot flashes, but I also learned about andropause where men also experience it. Is there an equivalent or like why do we get hot? I guess they don't have as much estrogen.
And the andropause is a little bit more prolonged than the menopause. So when you look at menopause, if we're looking at age 51 and a half in the United States being the average age, the transition to getting there on average about 4 years, although we see in Black women specifically that length tends to be longer. So think about that, like your risk of these severe symptoms longer. But on average about 4 years in the US, then it's over, right? Andropause is more prolonged. So you're not getting those kind of whiplash symptoms in the same way. A lot of the times people are experiencing a lot of the symptoms because of that delta, that change in the hormone therapy.
Oh, because it just goes,
exactly.
And the men's are just going,
it's just kind of slowly declining.
Reducing their testosterone.
And we see both those declines in both men and women, but it's the speed at which it occurs. So they might not have the same kind of like, it feels like on ramp, off ramp, with their hormones in the same way that we do.
Gotcha. Okay, so hot flashes are cooling the body down. And they're necessary, but you can prevent them if you stay in cool areas and you are managing your stress and you are...
your triggers.
Yeah, triggers, alcohol, chocolate. Wow, okay, this is like an entire life adjustment. I got it. But at least there's some ways you can prevent it. I didn't know there's ways to reduce it.
And I'm a big proponent of hormone therapy because when you understand the physiology about it, think about it. If you were here and your range is narrowed to here, if I give you a little bit of estrogen, again, it's not replacement therapy, it's really supplementation, I can widen that a little bit more. And so I'm giving you just enough to kind of help you through the symptoms. So when we widen that more, then you'll see that decline in the hot flashes and the night sweats and all of those other symptoms.
Gotcha. Okay. If you've enjoyed this episode of Fox After 40 and want to get notified about the next episode when it drops, make sure to go to CurlMix.com and sign up for our mailing list. We'll notify you whenever a new episode comes out. You may have touched on this, but I don't know that I understand it specifically. What role does estrogen play in maintaining your heart health?
That's a great question. Estrogen is amazing. Estrogen circulates throughout the body, and there are receptors throughout the entire body where estrogen can act from the bones, from the joint spaces, from the gut, including from how it impacts the blood vessels as well. And so one of the precursors to heart disease is actually the development of that atherosclerotic plaque, right? When we think about plaque buildup, you've probably heard that plaque buildup and risk of plaques and your LDL cholesterol and all of these other things. That is the precursor to the heart disease. That's the precursor to the heart attack, potentially stroke, et cetera.
And just real quick, can you clarify exactly what is heart disease?
So most people will define it like coronary artery disease or CAD, or heart disease is where you have general blockages in the heart that can compromise heart function.
Got it.
And so when we think about what are causing those blockages, is doing that? It's that atherosclerotic disease burden, meaning that you have these plaques that are in the vessels. And if you can imagine, blood going through it, yay, everybody's happy, you're getting good oxygen, you're getting blood delivery. But if you have plaques that are like blocking up that vessel, now you can't get blood to where it needs to go. So that plaque formation tends to happen as we get older over time. We know that lipids have a role there. We also know that controlling your blood pressure can have a role, because if your blood pressure is really high, it causes injury to those vessels. And guess what? That cholesterol likes to go right into those little injuries.
I have a, there's someone in my family who had heart disease, and they basically started having strokes, mini strokes all throughout the year. I want to say, when they first diagnosed him with heart disease or the issues, they were saying his heart only had 60% function. Then it dropped down to 40%.
Right.
Then it dropped down to 20%. And so he couldn't get like a weight loss surgery or anything like that, because his heart wasn't healthy enough. And I'm assuming it must be those plaques that were building up on
those vessels.
The vessels of the heart. And then it ultimately to the point where it was no longer functioning, so it's really sad. But I remember you'd be talking to him, and then he'd immediately go into stroke, and you're like, what happened? But we couldn't just take him to the hospital every time he had a stroke, because there was nothing they could do.
Right.
So it was almost just like he would have a stroke every month for a couple years.
Yeah.
And then they got really bad where we hospitalized for everyone.
Right.
And at first it started off like every 3 months. Then it was like every 2 months. Then it was like every month.
Yeah.
And then it was just like, it's also like such a crazy way to live,
Exactly. And it's so hard because we don't know until it's really late. Like, that's one thing about the body. The body can withstand a lot. And so you don't know. Think about like hypertension, for example. I'll see patients, they look fine, they feel fine, but I'll take a blood pressure and their blood pressure is sky high. That's why we think of like high blood pressure in particular is like the silent killer. And so you do have to be really vigilant about your health, because all of a sudden your body won't really signal to you that something's wrong until it's really far down the line. And when you think about the heart, again, plaques blocking blood flow to where it needs to go. The heart itself is also a very sensitive organ. Unlike the liver, that maybe you can have a liver injury, but then it can kind of repair itself, the heart can't. So if there's any sort of compromise to the blood flow that's going to the heart, like in that case, there was 60% function, that actually meant that some of that heart muscle was deprived of oxygen at one point and was no longer functioning well. And so it's progressive, right? Unless we do something to intervene.
Yeah. And so you said estrogen's role in that is to, what does it do?
So estrogen actually is protective with the vessels. Estrogen keeps our blood vessels supple, if you will. As we get older in general, our vessels become stiffer. And estrogen, I kind of think of it as keeping it more supple. The estrogen also prevents the deposition of like cholesterol and calcium in those plaques. So it actually delays the progression of the plaque formation. And so when we look at studies that look at people who were on hormone therapy, for example, versus not, we do see women who had a what we call cardioprotective effect, who were on estrogen. But it's the timing that's really important. So for example, if you start estrogen right when your estrogen levels start to decline, right, like with perimenopause and things like that, you're probably going to have better outcomes later on for your heart health. But say you went through menopause and now it's 10 years later, well, you had 10 years when estrogen wasn't around, so you may actually have some plaque development. You're not going to get the same benefit. So as we're navigating like the perimenopausal transition and trying to understand, okay, what is the benefit for me? It's really that timing. It's really that timing where we can actually have an intervention that works. Now, to be clear, I'm not saying take estrogen to prevent heart disease. Right. We don't think that that's what's going on. Right. But we do think that if you opt in for hormone therapy specifically for your menopausal symptoms, that you're going to probably have a bigger benefit than those who didn't.
And what you've been learning too is it's not just the estrogen that you're treating when you go get hormone replacement therapy or anything like that. It's the testosterone, it's the estrogen, it's the progesterone. Right. And then I guess you're also taking into account your thyroid and your vitamin D deficiency, potentially. So you need a comprehensive look, of course.
Absolutely.
I'm no doctor. What do I know? But
sounded good, sis. Sounded good.
I just been listening. What are some early symptoms of cardiometabolic decline that, or basically like heart issues that people need to notice early on that you might overlook?
Yeah. So one of the things that is a very vague symptom is fatigue. And exercise tolerance, meaning that maybe you're walking up the stairs and you find that you're a little bit more winded than you usually are, or you're walking up the stairs and you feel your heart racing, or you're just generally fatigued. And what's tricky about that is because that is such a very vague symptom. We're tired. So like, if you can imagine feeling fatigue or feeling like you can't do the things that you used to do, some people are like, well, this is just menopause. But I always say we cannot just blame everything on hormones. We really have to look at the function of the heart, which is generally why I recommend when you go to your primary care physician, they're going to do testing, especially like EKG, electrocardiogram. Some people do a little bit more advanced testing like calcium scores and things like that, depending on what your risk factor is, to be able to look at the heart directly. It's part of your well care. It's not just about hormones. It is, one of the vital organs. And so fatigue is one of those things that's very vague, but I always say, you know your body better than anyone.
What about so sometimes I'll get maybe a couple times a year, like a random sharp pain in my chest. And I'm like, what is this?
Right.
But then it goes away.
Right.
And I never feel it again. I can't predict it. I don't know what triggered it, but it definitely feels like a little lightning strike.
Right, a little lightning strike.
And I don't know if that's something to go to the doctor. I think I got an EKG before and it was normal, nothing. So then,
I always say, especially if you notice a pattern or if you feel like it's recurrent or you feel like it's progressive, go to the doctor. Like, get that reassurance that things are at least okay. Chances are when you're having like those one-off episodes that they're probably more musculoskeletal, right? Like maybe like your exercise, our muscles are throughout our body, like little sharp zingers, I call them, like may in fact be what you're experiencing, and then they go away. But it's more those progressive. And I want to point out that for women too, when we think of like heart attacks, for example, we're thinking about chest pressure, an elephant sitting on my chest, pain radiating down the left arm. That's not how it always presents specifically for women. It might present as nausea, just persistent nausea. It might present as fatigue. It might present as like just kind of like I don't feel well, like I just don't feel well. And so I always say you are in charge of your body. You know your body well. So if you're feeling those symptoms, like maybe the dizziness, the nausea, the fatigue, especially if it's with like activity or motion, see a doctor.
What kind of tests should you ask them to run for you?
So for well health, I always recommend annual testing of like your complete blood count, a complete metabolic profile, where they're also looking at your liver function, a thyroid screen, vitamin D assessment, an EKG, especially after the age of 45, and a lipid panel. And there are different governing bodies that will recommend the cadence of it. So whether or not it's like every year or every 3 years or what have you, but those are labs that generally should be done so that you're keeping an eye on things, blood pressure measurement, recording of your weight distribution. So some people will actually weigh their waist circumference because we know having a little bit more fat in the midsection actually increases your risk of metabolic syndrome, which is a precursor to heart disease as well.
What role does strength training play in your cardiovascular health?
Oh, I love this question because it's getting a lot of attention as it relates to the menopausal transition. So first of all, strength training is good in terms of maintaining muscle development. So for both men and women, as we get older, we lose muscle.
Of course.
We lose muscle. And for some women, it's accelerated around the menopausal transition. So getting adequate protein to help maintain muscle development through strength training is really important. Strength training is going to not only help you maintain your muscle mass, which is good for your metabolism, things like that, it helps with weight maintenance. So muscle is more metabolically active than fat. And so when you're actually working on maintaining that muscle mass, you're actually helping your metabolism along and you're keeping fat development off a line. Now, why is that important? We know that on average, if you do absolutely nothing, people can gain about 2 pounds a year. So over a 10-year period, you can gain 20 pounds if you really didn't kind of do much of anything.
Not me, girl. I would have gained like 50. But
no, it's like, what do you do with that? Like, what is the long-term risk factor? So the goal is to try to go into midlife, especially the midlife transition, in a weight maintenance, and strength training can really help with that.
This is a really interesting question. What's the connection between PCOS, thyroid disorders, and gestational diabetes that relate to cardiometabolic health?
This is a great one. So I'm going to start with PCOS because this is like my favorite. PCOS. So first, let's talk about what PCOS is. PCOS, or polycystic ovary syndrome, is a constellation of symptoms, but people think it's really related to the ovaries. It's not. It's a condition of insulin resistance. Right?
Oh yeah, that's why people go on these special diets to basically help their PCOS. I've seen that on Instagram.
Exactly. So the reason why it gets so much attention is because in women it has a direct impact to our menstrual cycle. It can have a direct impact for fertility. It can have a direct impact to like what we call our phenotype. So we can have like hair growth, we can have extra weight, etc. But really foundationally is a condition of insulin resistance, meaning that insulin levels are inappropriately high and it's acting on multiple systems in the body, including the brain. And as a result, it's having an impact on the ovaries. So I kind of think of it as the ovaries are just the innocent bystander here, just taking orders from the brain, and insulin is hijacking that system. Okay.
But what does that have to do with your heart?
Exactly. So what's happening is insulin is acting in the brain and it's increasing certain hormones inappropriately. So you have hormones that act on the ovary to give you a normal menstrual cycle. The hormones are namely FSH, or follicle stimulating hormone, and LH, or luteinizing hormone. I'm getting a little nerdy here. Well, that LH acts on cells in the ovary that produce testosterone. If LH is out of whack, which it is in PCOS, you get elevated testosterone levels or androgen excess. So that's where we're starting to get the acne, the hair growth, etc. The reason why that matters is because testosterone increases levels of LDL cholesterol. This is why before menopause, most women are 50% at risk for heart disease, and after menopause, they're equal to men. So that's why we start to see a lot of cardiovascular disease in men before we see it in women, because of that testosterone. And so we see that testosterone, it increases the precursor LDL cholesterol, which is, if it's elevated, that can have an impact on your risk for heart disease. In addition, it's also insulin resistance. So insulin is not really being read by the body. And so when you have insulin resistance, it can predispose these patients to things like prediabetes and diabetes. It also increases how much fat they have in the midsection, which also causes more insulin resistance. So now here we have two risk factors for cardiovascular disease. Now I actually looked into this because this was always the question that you see. We see hypertension, we see elevated cholesterol, and we also see increased risk of diabetes, all risk factors for cardiovascular disease. The question is does that really translate to an increased risk? And I would say that the data is kind of contradictory. We don't really know. But common sense being common, if we can mitigate some of those risks, then we should do it.
This is wonderful. This is great information. Thank you so much, Dr. Taniqua Miller. This is so helpful. I had no idea. You just think about hot flashes, you just think about these different things we were experiencing, but you don't actually realize this is like related to your heart.
Absolutely.
And then ultimately you're protecting the most important muscle. Pumping blood through your entire body.
Exactly.
You guys, stay tuned for part 2. We're going to go over sexual health, which is, I'm glad we started with heart health because you need to make sure your heart is working before we can even think about sex, okay? So is there anything you want to leave people with, Dr. Taniqua?
I would just say be the biggest advocate for yourself. You live in your body, and so when you're living in your body, you are the best one to tell your medical team what's going on. Sometimes you feel off. I want you to live in that truth. If you have a doctor that you feel like is writing you off or saying this is normal, but you know it to not be normal, advocate for yourself and be brave and find another clinician.
And where can everyone find you?
TaniquaMD.com, or you can find me on socials at Taniqua Miller MD.
Yes, and you're based here in Georgia, correct?
I am.
Awesome. Thank you guys so much for tuning into Fox After 40. I'll see you guys in the next episode. Make sure you like, comment, and subscribe.